Hello and welcome to the Health Show. My name is Shakil Salam and you're watching Ummah Channel, Sky 820. This is the Health Show for you and your family. We discuss various health-related topics and then give you opportunity to come on the show and talk about your concern, your experiences on relevant to the health-related issue. Today, we're going to talk to you about diabetes and eye care, the impact of diabetes on our health and well-being, but specifically on our eyesight. I'm delighted that we have specialists here who've been to in other channels and other programs in the past. First time coming to the Health Show. A warm welcome to Dr. Kamran Aftab Ahmed. Assalamu alaikum and welcome to the show.
Walaikum assalam. Thank you very much, Mr. Shakil, for providing me an opportunity to discuss this extremely important, though neglected issue. So, and I would like to congratulate you for this amazing show, and I wish you all the best for this amazing show.
Thank you very much, Dr. Kamran Aftab Ahmed. You work for Morecambe Bay NHS Trust. And you travel all the way, so thank you very much for coming along. You have specialist knowledge in terms of eye, but we're specifically concerned about diabetes and eye care. So why it is important for people with diabetes to understand more about their eyesight?
Well, as you know, that diabetes is more common in South Asian population, and unfortunately it has been largely neglected so far. So diabetic retinopathy is still one of the leading causes of blindness worldwide, and more specifically in subcontinent. So diabetes can affect your eyes in many ways, maybe more than a dozen of ways, and that can be harmful. But I would like to target specifically a diabetic retinopathy today.
Okay. Absolutely. Before we talk about that, just give us an idea about how our eye works. What is the importance of our eye and the vision, which help us to carry on day-to-day work?
Sure. Well, I think all of us know that how important can the eyesight be for your living.
Yeah.
Especially for the working population, you can't survive a single day or a single minute without your vision. So it is extremely important to take care of our eyes and of our sight.
And just imagine, if I close my eyes, there's nothing.
Absolutely.
And at least I can open my eye whenever I want to. But there are people who perhaps don't have that, chance to have. So diabetes can affect people. Can I just remind you that this is the Health Show, and we're talking about diabetes and eye care. If you would like to ask any question relating to the subject, please give us a call. On the screen, you can see some numbers. There are a telephone number, live call, so you can give us a call. At the same time, if you are expert on social media, you can go on our Facebook and other social media such as Twitter and Instagram. Whichever suits you, please do so. We'd love to hear from you, and at the same time, please go on Ummah Channel and like our page, and you will have all the information about the Health Show and all the show we do. Part of our Ummah Sky 820. Dr. Kamran Aftab Ahmed is with me, and we're talking specifically about diabetic retinopathy. What is it?
Well, as Shakil Bhai, I have told you that diabetes can affect your eyes in dozens of ways. And the most common way it affects your eye is with the diabetic retinopathy. In diabetic retinopathy, you get some leaky vessels, some leaky blood vessels at the back of the eyes. And those leaky vessels can start leaking some fluid, which can be some normal water, or sometimes those can start leaking blood. And unfortunately, both of these conditions can irreversibly damage your eyesight in the longer run if we do not treat these conditions in a timely manner.
So how do we know that somebody has, is it because of diabetes they have that leaky eyes?
Yes. Well, diabetes usually takes a few years to show any signs suggestive of diabetic retinopathy. It is more related to your diabetes control as well as some other factors like your high blood pressure and cholesterol. The people who do not care much about their sugar level, or people who do not care about their cholesterol level or blood pressure level, they tend to have these signs in early age, and these signs can affect their eyesight in relatively younger age.
When we talk about diabetes, there are two different types of diabetes, type 1 and type 2 diabetes. And I believe when we're looking at South Asian community, type 2 is much more common.
Yep.
So can the eyesight can be affected by either type 1 or type 2 diabetes?
Yes, diabetic retinopathy is common in type 1 as well as in type 2 diabetes. So as I told you, that it has more to do with your sugar control level rather than with the type of diabetes. Though obviously, I mean, the type 1 diabetic people, they are they present to you in younger age because of the onset of diabetes in younger age. But in type 2 diabetes, diabetic retinopathy is as common as in type 1 diabetic patients.
So let's talk about the cause of it. I mean, diabetes is probably the primary cause of it, but how do we know that people have, the eyesight affecting? Is it just happens straight away, or?
Unfortunately, in most cases, diabetic retinopathy is asymptomatic in most of the cases.
Okay.
And when people start realizing that they have got an issue with their eyesight, then at that point there is already some damage due to diabetic retinopathy, and in some cases that damage can be irreversible. So fortunately in United Kingdom, we have got a very good screening services for diabetic retinopathy, and they see every diabetic once a year just to make sure that they don't have any sign suggestive of diabetic retinopathy, or they don't have any sign suggestive of treatment.
Okay.
So I will strongly advocate to the listeners and to the viewers to go to diabetic retinal screening services regularly. Please do not miss that appointment once you get an appointment from them. If for any reason you can't go to them, for example, if you are overseas or if you are not in the country, then you can see your optician at least. Opticians, most of the times, they are pretty good in diagnosing these changes due to diabetes as well, and they can promptly refer you to an ophthalmologist or an eye specialist for their expert opinion.
Okay. So when we talk about it can happen at any age, or the older you get, the more chances are that your eyesight will be affected?
Usually, after the onset of diabetes, it takes approximately 10 years to develop some signs suggestive of diabetic retinopathy. But not all the signs need treatment. Some of them do need treatment, some of them don't. Okay. So, as I told you that type 1 diabetics, as they are relatively of younger age, diabetic retinopathy will affect their eyes in relatively young age. Yeah. And while on the other hand, type 2 diabetics, they present relatively at older age, because the onset of diabetes is relatively in old age.
I'm sure a lot of people wanted to know what sort of signs they need to look for it, where they are concerned that because of the diabetes, their eyesight is being affected. Is there any specific sign we need to look for?
As I told you that unfortunately most of the case, in most of the cases, these signs which are suggestive of diabetic retinopathy, they are asymptomatic. So as as long as they can seen by a health professional, they will not be able to feel any symptoms by themselves in most of the cases. In some cases, as I told you, that the people come with decreased vision or problem with their eyesight, and in many of those cases some damage has already been done because of diabetes, and sometimes those changes are not reversible. So, well, I would like to discuss the specific diabetic retinopathy. I mean, how does it affect your eyesight?
Absolutely, yes.
Yeah. So, as I told you that in diabetes, usually the blood supply of the eye compromises. So, the eye goes in relatively hypoxic state. So that's why all the blood vessels, they start leaking some fluid initially, and in some severe cases they can start leaking blood as well. So the fluid, if that affects the very central part of your vision or the anatomical part of your eye that we call as macula, it is when the damage is already there. So if they start leaking blood, then the person can experience sudden loss of vision without any pain or without any other obvious symptoms.
So blood bit is more serious.
Yes, it is, I'm afraid.
Okay. So when we're looking at, is there any headache or any other signs you can see?
No, I'm afraid in most of the cases you don't get any other symptoms apart from sudden loss of vision if you have got some blood inside the eye, or blurring of vision if you have got some clear fluid at the back of the eye. So, but you don't get any other symptoms like any headaches or any light sensitivity or any redness, etc.
So does it damage the retina? It can be affected, is it?
Yes, this is what I'm saying, that it will affect your retina. So if it affects the very central bit, then this is what we call as diabetic maculopathy.
Okay.
And the treatment of that diabetic maculopathy is with the help of laser or with the help of injections, or sometimes both. But yeah, if it affects the very peripheral part of the retina or the optic nerve at the back, then it can start, I mean, the blood vessels can start leaking blood. And most of the time, surgery will be required to get rid of that blood, and afterwards some laser treatment will be required.
Okay. Dr. Kamran Aftab Ahmed is with us. We are looking at diabetes and eye care, how diabetes can affect our eyesight, what is the treatment. We're looking at some prevention methods, and if you would like to ask any questions, please do ring us. There's numbers on the screen. There's a few different numbers. At the same time, we're on social media as well, so you can ring us, call us, text us, or send a message on Facebook or Twitter, whichever is easier for you. Dr. Kamran Aftab, we're getting some calls, and one of the question people are asking is relating to the pressure in your eyes. Can that be affected by the diabetes?
Well, there are many studies, and according to those studies, the incidence of glaucoma or high pressure is more common in diabetic people. And again, in the diabetic people, if you have got severe retinopathy at the back, I mean, if you have got leaky vessels at the back, then that can cause high pressure inside the eye as well, and that can be very dangerous sometimes.
You also mentioned in some cases it's reversible. So that basically means permanently you lose the eyesight.
Yes, I'm afraid that can be the case in some cases, yes.
So important thing is that have a regular check, make sure you're going to opticians or specialist team and having regular check.
Yes, this will be the key message for my talk from this forum today, that please keep your appointments with your opticians, with your ophthalmologist or eye specialists, and with the diabetic screening services in the community,
yes,
so that you can be promptly referred for expert opinion.
Yeah. So when you're talking about retinal therapy, retinopathy.
Yeah.
Are there different types of this, or just one specific type we're looking
Yes,
at?
diabetic retinopathy, well, it has got some early signs and some late signs. So,
So what will be the early signs of
in,
what sort of thing
yeah,
we're looking at?
if we are talking about specifically about the diabetic retinopathy,
Yeah.
the early signs will be few scattered hemorrhages on the retina. And most of the times, those hemorrhages do not need any treatment, but they are warning signs that diabetes needs to be very well controlled. You have to take care of your blood pressure as well as your cholesterol. If you are smoking, you have to quit smoking. You have to modify your lifestyle as well. And if we do not stick to these basic things, then that can get worse and it can start affecting your eyesight. And in some cases, the damage can be irreversible.
Okay, one of the questions we're receiving is contact lenses. Are they okay when people with diabetes? Can they use contact lenses or?
Well, most of the times people are okay to use contact lenses unless until unless they don't have any dry eye condition, because in diabetes you can get dry eyes more often than general population. So if you do not have any dry eyes, then you are okay to wear the contact lenses.
Okay, so when we look at, eyes are very important for us, and people with diabetes, and diabetes sometimes they call it silent killer, because sometimes people don't even know and they don't even get the sign for diabetes, and they find out at a later stage. Can it still be okay, can be preventable if people find out? I know the message is the sooner you get it checked, the better results are going to be. But we notice, that if people don't even know that they are diabetic and it hasn't been officially diagnosed, can they still affect their eyesight?
Yes, it can, and it does. I mean, in clinical scenarios, it is not very uncommon for us to see people with diabetic retinopathy, and after we have seen those patients, they were diagnosed with diabetes afterwards. So it is very common, relatively common scenario in general population, and especially more in South Asian community. As I told you, I mean, because most of the people who are from this part of the world, they have got very good relations with their GPs, I would say. I mean, they go to their GPs regularly for their MOTs once a year or twice a year at least. But unfortunately, the South Asian people, most of the times we are not in this country. And when we are, we don't go to our GPs for our regular checkup.
We only go when we need the treatment, isn't
yes,
it? I think
that's correct.
So the prevention side we don't take, and I think that's the important message.
It is.
We will
extremely
be giving.
important. Yes.
Looking at, we notice, that with age, cataract is very common. Is there any link with cataract and the diabetes?
Well, very good question. Again, yes, the incidence of cataract is more in diabetics than general population. And again, in diabetes, in diabetic people, you get cataract relatively at a younger age. Now, once you get cataract, then there will be more chance of progression of that cataract because of diabetes. And the chances, again, of complications during the cataract surgery or after the cataract surgery will be more, unfortunately, in people who are diabetics or people who do not control their blood sugar level really well.
So one of the key messages, people with diabetes, when they're looking at their diet and everything else, the key message is they're keeping their eyesight and making sure that the eyesight is up to the standard, and they're having regular checks and making sure that they go and visit their optician. Is the normal optician can look at
Yes, as I told you that most of the opticians in this country, they are pretty good in diagnosing the signs of diabetic retinopathy. So it is extremely important to go to your optician if you can't if you have not been diagnosed with diabetes in the past and you don't go into diabetic retina screening services, but you please, whether you wear glasses or not, please see your optician at least once every 2 years, if not once a year.
You mentioned glasses, you and me both wearing glasses. Do we need to worry about diabetes, or there's no link with glasses and diabetes?
Fortunately, there is no association between glaucoma, myopia or hypermetropia and diabetes.
Yeah. So when we're looking at eyesight can affect with different things, isn't it? But diabetes is one of the reason. But diabetes can affect there's a lot of complication with diabetes. So are you suggesting that if we control our diabetes, then the chances are that our eyesight will not be affected and we can prevent?
Yes, I mean either we can prevent the loss of eyesight because of diabetes. We can prevent that, and if we cannot prevent that fully, we can delay the onset of blurred vision or irreversible loss of vision.
So the later the more delay it happen, the more chances are that it's going to get worse and complications can happen more often.
Yes, that's correct.
Okay. All right, Dr. Kamran Aftab Ahmed is with us. He is eye specialist. Any question, please do give us a call. If you're concerned about your own eyesight, you're worried about somebody in your family who have diabetes, or even the children with eyesight issues, please give us a ring. We have a specialist person in our studio, and I'm sure he's happy to answer all your concern and question. Also, if you have any experience in terms of dealing with diabetes and eyesight or having any complications, please do discuss with us. The number is on screen. At the same time, you can give us a call and talk to us. And Dr. Kamran will be with us, and we'll carry on talking about the treatment, the prevention side of it, and we'll getting some key messages. We're going to take a short break, and we'll come back after the break. Just take care, and we'll see you soon. Allah Hafiz. Welcome back. My name is Shakil Salam, and you're watching The Health Show. Every week, this time, you can have access to Ummah Channel Sky 820 and watch your favorite program, The Health Show. This is designed to give you information about various health-related topics. And today, we're going to talk about, or we're discussing already, about diabetes and eye care. Dr. Kamran Aftab is my guest today, and he is going to answer your question, and at the same time he's going to talk about diabetes and eye care. What is our understanding about our eyesight? The structure of eye is the key thing we need to understand, and Dr. Kamran will talk to us about the treatment side of it, and at the same time we're looking at a prevention message. But if you would like to ask any questions, our lines are open. There's a number on the screen. Please do give us a call and ask questions. So welcome back, Dr. Kamran Aftab Ahmed. Mashallah, you have explained really well in terms of retinopathy and the impact the diabetes have on our eyesight. I think a lot of our community would like to understand more about the structure of eye. So when you're talking about retina and different terminology, it's better for us to understand, when you're discussing about leaky eyes and all that. If we talk about the structure, unfortunately we don't have pictures, but we can rely on your verbal sort of explanation. So just describe it. Small little eyes, and it's very small. It's one of the smallest.
Very small, but it has got a whole world in it.
Absolutely.
Yeah. So, well, it is the window to your brain. Approximately 90% of the diseases in the body can be monitored or can be diagnosed from your eyes only. So, yes, regarding the structure, the transparent bit part, which is at the front, it is what we call as cornea. So, and behind the cornea, there is an iris, which is usually brown or black in Asian community, and which is usually blue or green or gray in Caucasian population.
It depends which color contact lenses you're wearing as well, isn't it? People
Yes,
can change it nowadays.
Yeah. So behind the iris, there is a lens, and in cataract, that lens becomes opacified, and this is what we call as cataract. So behind that lens, there is an inner covering of the eye that we call as the retina. So in the very central bit, in the very central part of the retina, there is another well-defined structure that we call as macula, which is used for your vision.
Okay.
And near to the macula, there is a nerve that we call as optic nerve, which goes into the brain, and it takes all the signals from the retina as well as from the macula, and then those signals are sent to the brain for further processing.
So there's a term maculopathy as well, is it?
Yes. Well, it's a part of diabetic retinopathy.
Is it?
But sometimes the retina itself does not get involved because of diabetes. But the very central part, which is what we call as macula, it gets involved. And this is when we call this condition as diabetic maculopathy rather than diabetic retinopathy. So in diabetic maculopathy, again, some leaky vessels at the back of the eyes, they start leaking some fluid, and that fluid can start accumulating on the macula, and it can start affecting your eyesight as well.
So this fluid, does it come out of your eyes, or
it comes from the blood vessels on the retina.
Right.
So the walls of the blood vessels, those walls become porous. They start leaking the fluid from inside the blood vessel to the outside, and this fluid, it does not have any space to go, so it will start accumulating in the cells at the back. So most of the times, this part will be the macula that will be affected, and the macula is the very central part of the retina that we use for our day-to-day vision. So once that fluid starts accumulating in your macula, then it starts affecting your eyesight as well, if we leave that fluid for too long.
So if your eye becomes red, is that something you need to worry about it? Because sometimes when you're tired or if you didn't sleep very well, you can see sort of redness in your eye.
Well, diabetes usually, it does not cause red eye.
No.
Generally speaking, unless you get any episcleritis or scleritis because of some complications of diabetes or some other association of diabetes, it does not give you a red eye. So, I mean, there can be multiple reasons, many reasons for red eyes, but diabetes is usually not one of them.
Okay. So, right, let's talk about we talked about in terms of some of the impact diabetes can have on our eyesight. You describe very in detail some of the causes and some of the risks, and I think a lot of people wanted to know in terms of prevention. We'll come to in a minute. But what is the treatment? Is there any specific treatment people with diabetes, if they have eye loss or affecting their eyesight, what is the best treatment for them? Is there any treatment?
Yes. Well, again, it depends that whether they have got diabetic maculopathy. I mean,
Right.
the leakage of the fluid from the blood vessels onto the macula, which is the very central bit, or do they have any leaky vessels in the peripheral or far part of the retina rather than the macula? The treatment will differ. For diabetic maculopathy, specifically, we nowadays we do injections into the eyes. We do one injection every month, and sometime every 2 months, depending on the nature of the injection, for a few months, or in some cases for few years as well.
So when you mention injection, that really frightened me. It is really to eye because it's very sensitive. So injection, is it just in front of eye or at the back of eye? How the injection works?
Well, yes, it sounds frightening, but it is not in practice. It is not as frightening as it sounds.
It's for you because you're.
No, we do that on a routine basis. We do these injections on routine basis, and most of the patients, they don't feel any pain or anything in the eye during the injection, because we will numb the eye completely, and we will make sure that the patient does not feel anything while we giving the injection into the eye.
So what's the purpose of this injection? What this injection does to our eye?
Yes. So, Shakil bhai, as at the start of the conversation, as I told you that because of diabetes, some leaky vessels, they start leaking fluid. Before that, some chemicals are produced inside the eye, and those chemicals, they are usually called as a VEGF. We call them vascular endothelial growth factor, or VEGF in common terminology. So, and it is because of those factors, those chemicals inside the eye, that these blood vessels, they start leaking the fluid. So these injections, they have contain drugs which we classify as anti-VEGF. So these injections, they specifically target those chemicals. So once those chemicals are blocked inside the eye, then there will be less chance that they will affect the blood vessels to start leaking the fluid or the blood.
So, you know, when you mention injection, that really frightened me. What is the common fear when you talk to people about the treatment, and especially an injection is once a month? I mean, that must actually put a lot of people come forward. Is that true, or did you come across with that sort of thing?
Yes, I mean, as I told you that it sounds very frightening, but in practical life, it is not that frightening. Most of the people, they manage pretty well with these injections, and after these injections, especially once they start noticing improvement in their eyesight, or once they notice that their eyesight is not getting any worse because of these injections, they will be happy to have these injections. So there are different injections available under the NHS care now. So some of them will be required on monthly basis. Some of them will be required on 2 monthly basis, and there are few in the pipeline. Those will be required less often. But most of the times, these injections are extremely safe and extremely effective in preventing blindness, or in preventing vision loss due to diabetes.
So apart from injection, there isn't any alternative. Injections.
No, there are some other treatment modalities as well. When we did not had these injections, the mainstay of treatment at that point was, I mean, I'm talking about, let's say 5 years ago, we did not had these injections for the treatment of this condition, for the treatment of diabetic retinopathy. So at that point, we had laser treatments available, and we are still using those laser treatments in some of the patients. So in some cases, we will do laser as well as the injections, depending on certain factors.
How does the laser treatment work? Is it quite common, or is it quite effective?
Well, lasers used to be very effective until the advent of these injections.
So injection is the new
Absolutely.
treatment.
I mean, if the we claim that the success rate of these injections is approximately 70%. Okay. With the laser, we claim that the success rate is approximately 30%. So with these injections, the chances of improving your eyesight or preventing blindness are doubled than laser. But as I told you that in some cases we will do the injection only, or we will do the laser only, or we may have to do the laser as well as the injections, depending on certain factors and response to the treatment.
Okay. You're watching the health show. My name is Shakil Salam and I'm with Dr. Kamran Aftab Ahmed. We're talking about eyesight, specifically on diabetes point of view. If you would like to ask any questions, Dr. Kamran Aftab Ahmed is with us and he is happy to answer any of your questions. If you're concerned about diabetes and impact on your eyesight, this is the program for you. We know that there is a large number of South Asian community affected by diabetes, and because of the diabetes, one of the complication and one of the impact is on your eyesight, although there are many other effects of diabetes, but one of the key one is on your eyesight. So as soon as you have any opportunity, please go and have the treatment done. Look after your eye, it's really important. After the treatment, we're going to ask our guest to talk about the prevention side, which is a generic message for everybody who is watching us now. But diabetes is one of the common disease among most of us. I know almost at least one or two family members, and almost everybody knows somebody with diabetes because it's one of the commonest form and the impact it has. So today our message is very clear. Look after your eyesight, control your diabetes, control your blood level, sugar level, and blood pressure. This is the really important message. Dr. Saab, if we come and talk to you about the procedure, if somebody is worried about their eyesight, the person with diabetes, what is the first point of contact? Is it their own GP they have to go to, or the optician they need to go to?
It depends. For example, if someone who is diabetic, he has found that his eyesight has gone completely within few hours or within a couple of days or few.
So that can happen straight away.
Oh yes, that can happen. I mean, as I told you that if you have got abnormal leaky vessels at the back, they can start leaking blood rather than fluid, and that blood can affect your eyesight within few seconds or within few minutes or maybe within a couple of days. So it depends. If someone has got very profound visual loss, then they should see the eye casualty clinic, eye casualty services in that area, or they can go to A&E as well.
Okay.
But if someone is experiencing progressive but slow, painless loss of vision, then in that case, yes, they can either see their optician, and as I told you that most of the opticians, they are pretty good in diagnosing diabetic retinopathy and arranging a referral to the ophthalmologist straight away.
Yeah.
Or if you don't have access to optician, then you can go to your GP who can refer you to an ophthalmologist.
Yeah. People who are diagnosed with diabetes, they will have a screening process, isn't it? So they have diabetic screening as well as they have vision test as well. Is that part of NHS screening process?
Well, as I told you that we have got diabetic retinal screening services in the community, and they will see everyone with diabetes once a year.
So once a year is automatically they get appointment.
Yes.
They go and see the specialist. And
they will see a health professional who will take photographs of the eyes.
All right.
After dilating the pupils with some drops, and then some of them will see those photographs and will try to ascertain whether the person has got some signs of diabetic retinopathy or not, and if they have, do they need treatment for those signs. So they will refer those patients to us accordingly if they feel that the patient needs treatment.
Have you come across young children with sort of that sort of issue, you know, with their eye vision is affected because of type 1 diabetes?
Excuse me. Yes, Shakil bhai, as I told you earlier, that most of the times the diabetes takes approximately 10 to 12 years to show any signs of diabetes. So, for example, if a newborn is diagnosed with type 1 diabetes, it will take him approximately 10 to 12 years to show some signs suggestive of diabetes. So we don't see very young children with diabetic retinopathy because of the time, obviously. But we do see quite young people, especially people who are in their late teens or adults in their early 20s. We see them very often. Yeah. Okay. And unfortunately, the prognosis of diabetic retinopathy is worse in those specific cases rather than anyone with type 2 diabetes or anyone of relatively old age group, because in most of those cases the sugar control was not pretty good while they were pretty young because of many other reasons.
Absolutely.
So that's why they show signs of diabetic retinopathy which are usually more advanced than someone with maybe type 2 diabetes.
Yeah. There's type 1 diabetes and there's type 2 diabetes, and also we hear that, you know, the women who become pregnant, they can get diabetes as well. So one of the questions I'm getting now is that does pregnancy can affect diabetes retina problems during pregnancy?
Yes, this is again a very common and very important question. Yes, many women, they have gestational diabetes. I mean, they will usually not be diabetic, but once they get pregnant, they develop diabetes as well, as long as the pregnancy lasts. So, and there is another set of population which are already diabetics, and once they become pregnant, then the signs, the changes of diabetes or diabetic retinopathy, they get accelerated. So we have got a certain criteria for these two sets of population. So we screen them very often in the hospital while they are pregnant.
During pregnancy, there is screening.
Even after the pregnancy, yes.
So there is a system in place.
Yes,
so
there
during
is.
The screening, during the pregnancy, the screening process is there.
The screening process is there, but you have to approach to the screening services you have to come to the hospital to avail that opportunity, I would say.
Okay.
Yeah.
Right. That's absolutely fine. So any other complication can happen because of the diabetes and eyesight, and, you know, have you seen any worse scenario? What can happen?
Yes. So as I told you that the abnormal blood vessels at the back, if they start leaking blood inside the eye, then that blood can cause retinal detachment in the longer run. And retinal detachment, again, one of the most serious conditions of the eye, and in some cases it causes irreversible loss of your vision and eyesight. So, well, it is extremely important to get yourself checked for diabetic retinopathy. That's why. Yeah.
Okay, so we are discussing about diabetes and eye care, and this is very important subject. In a minute after the break, we are going to go and discuss about prevention side of it. Prevention is really important. And the prevention bit applies to everybody, even if you don't have diabetes, because looking after our eyesight is one of the key point we need to look into, consider as a person, as a human being. Looking after our eyesight is the key message Dr. Kamran Aftab Ahmed is going to give it to us. Again, if you would like to join and ask any questions relating to eye care, because he's eye specialist. A lot of people talking about diabetes as well. I know you're not diabetes experts, but can you just talk about diabetes signs? What sort of sign we're looking in terms of diabetes? I know that's not your subject, but
yeah, I mean it depends usually on the type of diabetes. First of all, for example, type 2 diabetes, which is more common in South Asian community, people will usually experience polyuria, which means increased urge to go to the toilets.
Yeah.
They will feel more thirsty, and they may feel that their appetite is they are becoming more hungrier. In other words, I mean, they will eat a lot. They can experience some change in their weight. Either they can gain weight within few weeks, or they can lose weight within few weeks. So in long-standing undiagnosed diabetes, it is very common to see people with some chronic problems like any ulcer, which is not non-healing. So, and most of the times these people they get sick very, very easily.
Okay. Just a couple of general questions people are asking about eyes. Nowadays there's social media. Everybody's on either mobile phone or iPad or watching TV. Is that something bad for your eyesight?
Well, many studies have been done in the past, and there are still many studies going on in many renowned centers of the world. But so far, we have not been able to see any correlation between the eyesight and the use of these gadgets. Well, yes, obviously, the kids. In kids, we can get some problems with if they are using their eyes too much with these gadgets. It is not because of the eye itself. It is because they are focusing their eyes too much at a certain point with their muscles. So they get some problems with their muscles of the eyes rather than their actual eye itself.
So muscles are not functioning, not working properly because they're concentrating on focus on one side.
Yes, that's correct. That's correct.
One of the silly questions, we always, carrots, are they good for your eyesight?
Well,
carrot halwa.
I'm afraid I don't have any
no
proof
scientific
so
proof.
far that carrots are good for your eyesight. But obviously, carrot is a good vegetable.
Yeah.
So I will always suggest people to use carrot rather than red meat.
So carrot halwa is no good, but carrot is all right, is it?
Yeah.
All right. We'll carry on talking about it. The next bit is all about prevention, and that applies to all of you. How we can look after our eyesight, what is the prevention, and what is the best tips from our specialist, eye specialist, Dr. Kamran Aftab Ahmed, is going to be with us for next part of the show as well. So we're going to have a short break, and after short break we'll be back. So if you have any burning issue, any questions, please do call us. We'd love to hear from you. So let's have a small break. See you after the break. Assalamu alaikum. Welcome back. My name is Shakil Salam and you're watching The Health Show. I'm delighted that we have eye specialist in our show today, Dr. Kamran Aftab Ahmed, who is from Morecambe Bay NHS Trust. He is eye specialist and we're talking about diabetes and eye care. We discuss about a couple of key issues which affect our eyesight. We'll look at the treatment side of it. This part of the program, we're going to concentrate on the prevention side of it. What can we do to prevent our eyesight? And this is the key message for all of you. We don't have to wait until we get diabetes or affected by eyesight. We need to start looking after our eyesight now. So Dr. Kamran Aftab, what are the key messages, what are the tips you're going to give us to look after our eyesight? And that could be quite general because I think everybody who's watching us, they need to take some messages from you. So what will be your advice?
Well, there is an old saying that prevention is better than cure.
Yes.
It is
it
more, it has to do more with diabetes, I would say,
yes,
than anything else. If you can control your sugar level really well, first of all, if you can prevent diabetes at all, that will be the best thing that you can do for your life. Healthy lifestyle, healthy eating, a lot of exercise, and prevent smoking, abstain from smoking, keep an eye on your blood pressure, keep an eye on your cholesterol, and the chances of developing diabetes will be less than the general population. If we can prevent diabetes, I can't ask more than that. But if you have got diabetes, then again, you have to keep an eye on these factors. You have to modify your lifestyle accordingly. Eat healthy food. Please stop drinking, stop smoking. Keep an eye on your sugar level. Keep an eye on your cholesterol level. Keep an eye on your blood pressure. If you can stick with these advices, then the chances of developing diabetic retinopathy will be very less. And even if you develop diabetic retinopathy, the chances will be very less that you will need treatment for those changes. And even if you need treatment, the prognosis of vision or the prevention of blindness, the chances of preventing blindness will be more if you can keep an eye on these factors.
So you mentioned about smoking. How smoking can affect our eyesight? What's
yes,
the link?
Unfortunately, the smoking it affects your blood vessels.
Oh, it does.
So because of diabetes, the blood vessels are already damaged. So the people who are smoking, the damage becomes worse.
And now, this day and age, a lot of young people, not only just smoking, they are into shisha and hookah smoking.
Yes,
as
when
well.
I say smoking,
exactly
it
the
means
same thing, isn't it?
cigarette smoking, it
Yeah.
means pipe smoking,
Yeah.
or it means shisha smoking as well.
It's
Smoking
the
in
same
any
impact.
form.
Yeah.
Yeah, correct.
And also, our eyes need a rest because we are constantly on social media, we are watching TV. And I'm not saying people shouldn't be watching TV because if they don't, they can't get our program. So these are the messages that are really important. But you said although it doesn't affect, but it's the concentration and it's probably tiredness of your eyes, isn't it? I get tired.
Yes, the eyes, they don't get tired. The muscles of the eyes, they get tired. Yeah, like other muscles of our body, like muscles of our arms, our legs. If we walk for too long without any break, we will get pain in our legs because of the usage of those muscles. So in the same way, if we use our eyes constantly on a certain object, then the muscles around the eyes, those control the movement of the eyes, they will become, they are likely to get fatigued, and it is likely that it can cause some discomfort or some pain.
So when you're talking about muscles, getting tired or affected, is there any solution for that? Is there any treatment? How can we get our muscle?
Well, yes, especially if you are using some gadgets like computers, laptops, or games, mobile phones, please try to avoid concentration for too long on those gadgets.
So need breaks in between?
Yes, after 5 minutes, give your eyes a minute of break at least, if possible.
Yeah.
That will definitely help.
Is there any spray or anything you can suggest, for people, who are...
Well, there are, yes, recently...
You don't have to give the name of it.
There are many sprays available in the market for dry eyes.
Yeah.
So, yeah, in diabetics, the incidence of dry eyes is more than general population. So
why do we get dry eye? What is the reason for dry eyes?
Yes, our eye has got many glands, and those glands are continuously producing tears to lubricate the cornea. With increasing age, those glands become less functional. So in diabetes, especially those glands, they become less functional at relatively younger age. So those glands, they stop producing the normal tears. Those are required to lubricate the cornea. So that's why people can get a lot of irritation in their eyes. They are more prone to get infections of the eyes. They are more prone to get red eyes because of those infections, or because of dry eyes itself.
Okay.
So yeah.
Tears, are they good for our eyes?
They are necessary for our corneas, for the health of our corneas, because they have got all the nutrients, those are required. They have got all the oxygen that is required for the cornea. They have got all the proteins, those are required for the health of the cornea. They are basic necessity for the cornea.
So crying is good?
Well, not in that sense, I'm afraid. So when I was talking about the glands in the eyes, I was not considering our lacrimal gland. So during crying, we use a lacrimal gland more than those normal small glands.
The question I need to ask you is, there are some people who you never seen the tears coming through. There's some people normally don't get tears. Is that true that people don't have tears at all because of the way they're made up?
Yes. Well, there are many general health conditions and some eye conditions as well that can lead to dry eyes. So either they will be producing no tears at all, or they will be producing less tears than what is required. So, and that can be sometime dangerous for the eye as well. And it is, again, as I told you, it is unfortunately more common in diabetics, because these glands, they burn out more quickly in diabetic patients than the general population.
I'm not expert on eyes at all, but I know if people don't have tears, do you think it's appropriate for them to cut onions and get the tears? Because that is one thing you can get tears, isn't it? What's the logic behind that? Why people, when they're cutting onions?
Yes, it has got a special volatile oil in it, the onion. Unfortunately, I have forgot the name of that volatile oil, but it causes irritation of the lacrimal gland.
Onion got that specific chemicals or that oil?
Yes, that's correct. So that's why, once that volatile oil makes a contact with your goblet cells or with the cells of the eye, they start producing tears.
So people who have dry eyes and don't get tears, do you think it's good treatment for them to cut onions?
Well, I'm not sure. For how long can they cut the onions for? They can't do that for 24 hours, can they? But we need tears for 24 hours.
So does that mean a lot of good chef, they actually don't get dry eyes?
Well, I haven't think about that.
There's no scientific proof yet.
No, I don't have any, I'm afraid.
So eyes are important for us. without eyes, our vision is no longer there, and it's really important. You know, there are different methods. You know, the glasses you and me wearing, the contact lenses. There are different sort of methods being used. People also use lasers nowadays for normal eye sort of sight. What contact lenses, glasses, is it just preference, or is there one thing better than other, or?
Well, I personally think that if you can cope with your spectacles, this is the best thing that you can do for your eyes.
Okay.
Laser, they are pretty good, pretty safe, but they are still not 100%. They have got few complications associated with them. And especially once you become old, then you are more prone to get those complications if you had a laser treatment when you were young. Contact lenses, again, we see, I mean, I work in ophthalmology, I work as an eye specialist. In my daily practice, I see a lot of people who are contact lens user, and they develop severe complications because of the contact lenses. So that's why I do not usually educate the use of contact lenses.
And now these are part of fashion, you know, those colorful contact lenses, people use it. What, do you think they are safe, or are they?
Well, as I told you, that I will never ever advocate the use of contact lenses.
Whether they are for fashion or whether they are. Okay. All right. Dr. Kamran Aftab Ahmed is with us, and he is going to give us some key tips in terms of looking after our eyes, looking after our health and well-being, and looking at diabetes and eye care. This is a key message for our community, because diabetes is a growing concern, especially type 2 diabetes, very common with large number of South Asian community. Type 1 diabetes also very common with some young people. But when it comes to eye complication, diabetes is one of the key cause of the eyesight. Can we say that diabetes is the key cause of it?
Yes, as I told you, that it is still one of the leading cause of blindness worldwide, especially in developing countries of the world. So diabetes is still one of the leading cause of blindness worldwide. Yes.
And we specifically talk about diabetes, but there are a lot of other eye issues and eye sort of concerns. You know, we talk about cataract. That's very common, isn't it? Is it age-related cataract?
Well, yes, cataract is usually age-related phenomena, but it is curable.
Is it?
Usually, the cataract is curable. I mean, once you remove the cataract and once everything goes according to the plan during the surgery, the outcome is extremely good. But on the other hand, diabetes, I mean, with the new medications, those we inject into the eye, prognosis has improved a lot, but it is still not 100%. So we cannot guarantee anyone that after having the treatment for diabetic retinopathy, we will prevent the blindness. We cannot guarantee that. We cannot guarantee that with the cataract as well, but the chances of recovery, or the prognosis for vision is much better in cataract than diabetic retinopathy, for example. So there are many other conditions, chronic conditions of the eyes, like glaucoma, which means high pressure in the eyes. So the glaucoma is again one of the leading cause of blindness worldwide. So,
and is glaucoma has linked with diabetes?
Well, because of some complications due to diabetes, you can develop some secondary glaucomas. And unfortunately, those secondary glaucomas, they have bad prognosis than the primary or normal glaucomas, I would say. I mean, normal glaucoma can never be normal, but the glaucoma, which are not due to diabetes, they have better prognosis than the glaucomas which are secondary to diabetes.
Okay, so when we're looking at our eyesight, in normal circumstances, when you are, we got blurred vision, or you got sort of eyesight, your reading is affected and things like that. When you're diabetic, is that much more common, that your eyesight will be affected more? Because normally with age, you probably change your glasses, or your vision, sort of closer vision or distant vision changes.
Yes, I've understood your question. Well, as far as the near vision is concerned, that will obviously change with the increasing age. You will need some glasses after a certain age, and you have to keep on changing those glasses until you are 60 or 70 years of age. That is normal. I'm not concerned about that.
Right.
But if your distant eyesight is getting changed, or your spectacles are getting changed for the distance, maybe once a year after a certain age, then that can be something serious, especially if you're diabetic as well.
Okay. So that's
Because in diabetes, as I told you earlier, that you can develop cataract at an early age. And if you have got a cataract already before the diabetes, then after the diabetes, there is a chance that the cataract will get worse. So if the cataract gets worse, there's a chance that your distance vision will change. You will need spectacles more often than once a year, maybe, for the distance, for the driving. And sometimes if the spectacles, they don't help, then there may be a damage on your retina because of diabetes.
okay.
And in those cases, the spectacles are not going to help anyhow. You will need treatment for diabetic retinopathy specifically,
Okay.
which will be injections or laser or both, or maybe surgery.
Yeah. Okay. Finally, what will be your advice for people who are watching us now to look after their eyesight, whether they're diabetic or not? How often do we need to go and see optician? How often we need to have regular checkups?
Yeah. Well, yes, that will be the key message for this program. If you are diabetic, please go to diabetic retinal screening services. Please do not miss the appointments with them. They are here to help us. If you are not diabetic and you don't wear any glasses and you feel that your eyesight is brilliant, perfect, then go to your optician twice a year maybe. If you are you wear glasses for distance, for example, or if you are a contact lens user, then you have to see your optician more often than that, maybe once a year. If you don't have access to your optician and you are diabetic and you feel that your eyesight has dropped down, please do not take that lightly. Please seek help from your GP or from your local hospital, depending on the extent of visual loss that you have.
So you work in hospital, so you get people who are referred by either GP or optician or whoever it is. Is that the case? People can't directly come to you, can they?
Well, depends. Yes, usually we accept people through proper channel, which will be through GP, through optician, or through A&E, or maybe through from their diabetic retinal screening services. But sometimes patients call us directly, and if we feel that this is something serious, then we ask them to turn up in the hospital directly rather than going to somewhere else.
Yeah.
and wasting the time.
So time is essence, isn't it? People need
Absolutely.
to seek advice as soon as possible.
Sure.
Delay is going to affect.
That's correct.
So a lot of these, if people go on time and seek help on time, these eyesight, these issues can be preventable.
These issues can largely be dealt with if the patient approaches us
on time.
On time.
And early.
That's correct.
As soon as possible.
Yes,
that's the key
correct.
message, isn't it?
It is, yes.
And people don't have to worry about the treatment side of it, because you mentioned about injections and people get frightened, but there's nothing to worry about it.
No. As I told you that most of the patients who undergo those injections, once they start feeling improvement in their eyesight, or once they feel that their eyesight is not getting any worse, then they tolerate these injections pretty well. And most of the times these injections are extremely painless.
And you won't advocate smoking, you want people to give up smoking, because
yes,
that's good for your eye.
Absolutely, that is.
And I noticed, if people are smoking in front of you, even if I'm not smoking, but somebody's smoking in front of me, I sometimes feel that my eyes are actually affected by that. Is that
That's correct.
true?
That's true. That's correct. Because the smoke itself, it can harm the glands of your eyes. Those produce tears. So yes, that's why you get a lot of irritation once if someone is smoking in front of you, and if you get any smoke from that cigarette in your eyes.
So people who are smoking, if you're not a smoker, but if you're in the company of smokers, then that could have impact on your...
That can, obviously, yes.
So finally, I know we talked about specifically on diabetes today, because when we're talking about eyesight, there are a variety of different conditions, and we can do probably different programs on that, but we talked about diabetes specifically. What will be your key message relating to today's topic? What will be the one key message you would like to give it to the community?
Well, again, I would like to focus on the importance of the screening services that we have got in this country, and the expensive medications those we have in NHS for the treatment. So please do go to your diabetic retinal screening services or to your optician, so that you can be referred to us promptly without wasting any time. And if your doctor advises you to go ahead with the treatment, please do not hesitate. Please go ahead with the treatment. These injections, these lasers, they are extremely helpful, and most of the times these treatments are without any significant or irreversible risk.
Dr. Kamran Aftab Ahmed, I'm really delighted you came along today. You discussed a very important subject today. Thanks for taking your time. Thanks for coming along.
Pleasure is mine. Thank you.
And inshallah, hopefully we'll invite you to discuss the various other conditions in future program. But thanks for coming along.
Thank you.
This was Dr. Kamran Aftab Ahmed, who is eye specialist, specifically discussed about diabetes and eye care. There is a huge amount of knowledge and information we got today. We talked about the condition, we talked about the treatment, and we'll look at the prevention side of it. Inshallah, I'll see you next week with another program, with another guest. Till then, goodbye and look after yourself. Allah Hafiz.